Well, in today's Health Watch, experts now say some adults may need to start thinking about cholesterol risk a little bit sooner than they may have anticipated out there. So joining us now is Dr. Lindsey Fish. So what are some of the key messages that the new guidelines that maybe the viewers need to know about?
Yeah, so it really is this recognition that people don't always have symptoms when they have high cholesterol, which is the leading cause of heart disease. And so these new guidelines are all about prevention. Things we talk about all the time, and we'll talk about them again, and also really about a personalized approach to testing and treatment, and recognizing that we want to empower our patients to not only know their cholesterol numbers, but their overall risk and take action early.
Okay, so people like my age maybe aren't having cholesterol quite on their radar yet, but why should they start paying attention to cholesterol?
So cholesterol doesn't give you any symptoms until you have a complication. And so LDL cholesterol, which is the bad cholesterol, builds up in your arteries over time. So we know that the sooner we start treating it, the less likely you are to have it build up and cause these problems. So these new guidelines shockingly recommend an initial cholesterol test at the age of 19.
What?
And then the use of a tool called the Prevent tool at the age of 30, which take into account a lot of different factors to really help understand your risk, not only right now or in the near future, but 10, 20, 30 years down the road, because we can now empower our patients to know now, to make changes now to prevent something from happening 30 years down the road.
Well, 19, that is fascinating.
19.
I feel like they keep pushing the guidelines higher, older and older. So that's really interesting.
Yeah.
Okay,
Yep.
So you also mentioned an emphasis on a more personalized approach to testing and risk. So what should we be asking our doctors? I mean, I don't think a 19-year-old's going in saying, test my cholesterol.
Yeah, well, hopefully not, but hopefully the doctors are now going to start offering. And I think the first thing is, one, it's not just about the number. Is it high or normal? It's what does it mean for me as a whole person, and other risk factors. There's a new test recommended, the lipoprotein A test. This is a test looking for an inherited cholesterol that isn't part of our normal panel. Everyone should have that. We really want to spend time with patients looking at their own risks, their lifestyle risks, their family history that contribute. And we actually have additional tests available if we need to really evaluate where somebody's at, and we can do that.
Okay, well, Dr. Fish, thank you so much for breaking down these things. I mean, now I have to think about cholesterol, guys. All right, so something just to add to the list.